I think it's very important to give an update every now and then. I didn't think it was necessary last week. I don't know if we'll continue every single Motzei Shabbos. We'll look and see how things are going. Just a couple of very brief announcements beforehand. There will be another program tonight that the shul is putting on in conjunction with, I believe, the Young Israel Law in Cedarhurst. That is a special program commemorating Linda Mitgang, Aleha Shalom, my good friend Charlie Mitgang's wife, and it's being sponsored by him and his children. And it's a program that will have an opportunity to hear from Rabbi Yehuda Sarna and also his wife, Dr. Michelle Waldman Sarna, who are now the Rabbi and Rebbitzin of the United Arab Emirates. And it'll be a fascinating talk that will begin at 8:45. We'll end before then, obviously, to give people a chance to grab something to eat or use the facilities before that program starts. Everybody's welcome to stay on for that program.
And Rabbi, Congregation Beth Shalom is also sponsoring.
Beth Shalom as well. Thank you. And if I'm not talking loud enough, please, Rip Shmuel, please tell me. So I'll try to keep my comments relatively brief, and then we'll take some time for questions through the chat, please. And I just want to also use this as a very important reminder to tell everybody that there's an election this week. And obviously, this is something that is critically important. I'm certainly not going to tell you who to vote for. I will tell you, however, that it's critically important that everybody vote. When politicians, governments look at our particular area, but they look at any Jewish area, they look to see the percentage of the Jewish vote, not necessarily who they vote for, but to see what important block is present there. And if we only have a 20, 30, even 40% showing, they look at us as not being people that they need to look after and to look to see what we need. But when they see 80, 90% of the population showing up to vote, so I think that sends a message. So I'm not telling you who to vote for, but I think that it's really incumbent upon everybody that they go out and vote through any of the mechanisms of voting that are still available, and to make sure that our community's votes, whatever community you live in, to make sure that those votes are heard and counted, and that we don't lose our political clout, because this is something that's extremely important. There are various apps and devices that some of the shuls have gotten into, something called Klal Vote. So just to compare and show where in the shul people are voting in terms of numbers, not in terms of who you vote for. But again, the critical thing that everybody should do is to make sure they go and vote and make sure that our community's say is certainly heard and seen in the government. In today's Haftorah, we had some famous words. What does that mean? So this is essentially those that are pandemic fatigued. What the Navi is telling us, the great Navi Yeshaya is telling Klal Yisrael, you guys are exhausted. You're tired from all the troubles and all the persecutions that you have. And every generation has its own difficulties and troubles. So Yeshaya says, don't worry. HaKadosh Baruch Hu will give all of us koach. He will get us through whatever we go through. HaKadosh Baruch Hu will take care of all of our needs. He will help us out. But those people that don't believe in HaKadosh Baruch Hu, they don't follow what the Torah tells us to do. So those individuals, even though they're young and strong, will in fact find themselves exhausted and tired. And the Kovei or Koye, different ways how to pronounce that word, the Koye Hashem Yachlifu Cholach, they will be given renewed energy, renewed vigor. And in fact, Lo Yigo, Yelchu V'lo Yafu, they will be able to manage and get through this. By Twersky Shlita wrote another beautiful letter that's kedai for every single person to read inside. But again, his main point is what I will just stress, and that is that people who may have the name Rabbi in front of their name, if they're distorting Torah values, if they're distorting the way the halacha is paskind, and they're on their own saying things for which they have no either medical or halachic right to say, so these people are making a tremendous chilul Hashem, even if they happen to have long beards, and even if they happen to have positions as a rabbi. They have no right to go and make a chilul Hashem. They have no right to distort Torah values. And this is critically important in this time. because I want to give you some of the background epidemiological investigation and information that is crucial for us to understand where we are right now at this point in time. Right now, the world is seeing huge increases. Even though Baruch Hashem, in our own little neighborhood here, we've seen Baruch Hashem a plateauing and even a decrease in the number of new cases. The United States has seen rises that it has not seen even back in March, April, and May in the numbers of cases. We're seeing over 500,000 new cases in a week. Today, we're almost at 100,000 cases today. We were at 90,000 new cases on Friday, Erev Shabbos. These are staggering numbers. In New York, we're seeing numbers that we haven't seen since late May. We have over 2,000 new cases every day. New Jersey is seeing huge increases as well. This is critically important. In Nassau County, we are seeing increases as well that are a concern. Baruch Hashem, in our 5 towns area, in some of the surrounding larger Jewish communities in Nassau County, the numbers have gone down in the Jewish communities. In those previously in the top 5, the 5 towns, all in the top 5 or 6 for the last couple of weeks running, Baruch Hashem, most of them have gone out of the top 5 and the numbers have come down. And that's wonderful news. If we want to keep things open, and that's always been the goal, to maintain as much normalcy as possible, the only way to do that is to make sure that we don't become a hotspot. Clearly, governments have closed things down. In Europe, things are exploding. They are seeing a tremendous number of new cases in Europe. Their numbers are far higher now than the United States. It's reversed from what it was a month or so ago. In Europe, they're seeing tremendous numbers of cases, but we're not doing as well as we were in New York State. There are now 118 people intubated. We have over 1,000 people in the hospital right now. In the United States, 41 states are worse this week than they were last week. 13 of those states are at the highest that they've ever been. These are numbers that are very scary. And if we don't take it seriously, I don't want to sound like a broken record for those that remember what a record is. But there are certain critical principles. Anthony Fauci and the 2 of his colleagues from the National Institute of Allergy and Infectious Diseases wrote a very important op-ed in last week's Journal of American Medical Association. And they talked about the vaccine and how that will hopefully change things, and I'll talk about that momentarily. But they stressed that the vaccine alone will not, for a long period of time, even if the vaccine is very effective, be able to save us in the short term. In the long term, there still is tremendous hope that it can be an answer, but certainly not in the short term. And short term means over the next 6 months, at least, if not longer. And if we do not continue, especially as it's getting colder and as more things are being brought indoors, clearly, if we do not mask and distance, especially when we're indoors with other people not in our bubble, it is just a disaster waiting to happen. We don't want to go back to the way that it was. This is the absolute unanimous medical opinion. There is not one infectious disease society, Department of Health, or even an individual infectious disease physician that disagrees with this concept that masking and social distancing, appropriate hand washing, remain the essential ingredients. And as we go indoors, there's more of a concern because people will be in areas for a longer period of time indoors with possibly poor ventilation as the windows aren't open and if the rooms are small especially. These are concerns. We want to stress that we don't want to change the davening that we're doing, but we need to make sure that the davenings remain crisp and that the davenings are not extended longer than necessary. Shiurim can go on indoors, but they need to make sure that people aren't sipping coffee while they're having shiurim. People aren't eating while they're having shiur because that means their masks are off. And even if you're distanced, if you're in a relatively small room, and again, it's always unclear what the ventilation is like in each of these rooms, so there's a potential that this will in fact lead to spread within that room. When people are in a room together for an hour, for 2 hours, for 3 hours, so then the potential for spread when people are unmasked, even if they're distanced, increases. And there are a lot of models that have looked at this. They're not perfect, but there are models that have looked at this and suggest that, again, the duration of time, in addition to masking and distancing, is a very, very important factor. There's a decent amount of data that has recently come out on masks to, again, suggest that the wearing of a mask is highly preventative, but it's certainly not perfect, of spread of illness. And it is going to reduce, there's studies that suggest that it's already saved in the United States the same number of lives that have lost. Over 230,000 lives have been lost. Horrible number. Masks have estimated to have saved that many lives and will continue every day that people wear them to save lives. It's, again, astounding that a ball player on a World Series team who's known to be positive is willing to put everybody at risk so he can celebrate with the team. I don't know what rationale anybody could possibly have for doing that. Certainly there's no halachic permission. Halacha would say it's usur, absolutely usur, for that person to be around other people, especially when those people haven't given permission. And Allah has kama v'kama, how much more so when people around him, the security staff said, we absolutely don't want him here. When you have symptoms, you must stay home. That's the other most important critical thing. If someone in your family is sick, don't go to shul. Don't go to shiurim. Don't go to work unless you're an essential person. And then there are rules for that, how to govern that and how to go and make that as safe as possible. There are constantly outbreaks in hospitals. There are constantly outbreaks in other places where people break the rules. Again, I ask people, think back what it was like around Pesach. And if you want to go back to that, so then don't listen to anything that I'm saying. The numbers in the world are getting worse, not better. And even, thank God, in our little neck of the woods where it's a little bit better, the numbers are still worse than they were in the summer. And we want to keep the numbers as low as possible to maintain businesses being open, to maintain yeshivas being open, and certainly that we should be able to have as normal religious life as possible. There's been a number of papers published that I wanted to very briefly talk about that have, I think, a tremendous amount of promise. The, quote, cocktails, the Regeneron synthetic antibody product, had 2 good papers published this week suggesting that given early on, they may have significant benefit. This is the first time we've seen something as powerful as this. The remdesivir studies were not as powerful as this. The convalescent plasma studies are still up in the air, and there's even some information to suggest that they're not as effective as we were hoping they would be. But the Regeneron product, there were 2 studies published, and with the Eli Lilly product, there was 1 study published, and all suggested that when given early, the synthetic antibody cocktails, they essentially are souped up plasma therapy. And this type of a therapy may be extremely helpful in when people do get sick, even as vaccine hopefully comes out, that can minimize the mortality. And that would be wonderful if we can decrease the number of cases. And then even those cases where people, chas v'shalom, do get sick still, we can minimize the mortality. There are a number of studies that have shown that the mortality is decreasing in COVID because of our better abilities to care for these patients. But unfortunately, we still have deaths from COVID every day, and the number of deaths in the United States is increasing, not decreasing. So it's critically important for people to realize that as we get new therapies, that's going to be a fantastic game changer, but it will still put people at risk, even with new therapies, even with a vaccine, until we reach the much heralded herd immunity concept that we look forward to getting to. There was an interesting study about masks that was just published as a research letter in JAMA that showed Despite everybody saying that, oh, the masks are causing trouble for older people, no, the masks are not. They did oxygen saturations on people wearing a mask and without wearing a mask, and there was essentially no change, no difference. And I think, again, the argument that masks are dangerous or harmful is just absolutely false. There is zero evidence, no published data to suggest that. Again, I know they're not comfortable. I laned this morning. Wasn't the most comfortable thing to go and wear a mask while I was laning. But you know what? It also wasn't the most uncomfortable thing to do. You do it because you have to. I hopefully protected every single person. If chas v'shalom I had asymptomatic COVID, I hopefully protected everybody else by making sure that I was wearing a mask and that people were appropriately distanced. That's the approach we must have. I can't stress it enough. It has to be a concept that we're doing mask wearing to help other people. And again, we do it as best as we can. We can't always be perfect about it. And we don't need to yell at people who aren't wearing a mask, but we need to politely tell them, I can't be in your presence if you're not going to wear a mask, whether you're family, whether you're a friend, whether you're a person in shul. It has to be 100% compliance in public areas like that. What people do in their own houses, what people choose to do on their own, I may disagree with it. We're not the police. But in a public area, especially in indoors shul, indoor yeshivas, we have to follow the rules, whether you agree with them or not, because other people are very uncomfortable with that. There were a number of COVID outbreaks in not only professional sports teams, but in high school and college sports teams, which again suggests that heavy breathing expels a tremendous amount of potential virus if somebody is even asymptomatic, and in close contact, like the soccer team and hockey teams that had published reports about them. So this is a concern, and people are constantly asking me, is it safe to do this? And my answer is, unless you're wearing a mask, I don't think it's something that should be done. Even with a mask, I can't guarantee that it's a safe activity. If it's reasonably distanced indoors and not in close proximity, I think it's reasonable. We've gone back to having some basketball skill shooting and layup practices in the shul without direct, close personal contact. So I think we're trying to be as proactive as possible in allowing stuff. But if people don't follow the rules and if people take liberties, there is the potential that it will close everything down. Finally, there was a couple of papers that looked at air travel. And Baruch Hashem, air travel doesn't look to be as risky as some of us originally thought or were concerned about. And while there is proven transmission on airplanes, I think if people all are masked and distanced as best as possible, and people are very careful about washing their hands, one of the most common questions I get is, can I go on a plane? So I think, again, it's an individual decision if people wish to. It's something that they have to decide they want to or they don't want to. But certainly if somebody has to do it for business, or if there's, Baruch Hashem, a reason that you have to go, hopefully a simcha, that you have to go someplace. So I think people can go with a reasonable expectation that it's safe. The last thing I'll just talk about is the vaccine. So in the two mRNA, the Moderna and the Pfizer vaccine candidates, they each have enrolled over 30,000 patients to date. And they're in the process of analyzing that phase 3 study. I don't know any preliminary results. There's a lot of excitement about it still. There's no evidence that there's anything dangerous from it. They haven't been stopped, obviously. There hasn't been any strange information coming out from these studies. But the hope is that, again, that there will be hopefully the opportunity to actually start giving these vaccines to healthcare workers at first before the end of the year. And I stress, no one will recommend these vaccines unless the data are transparent and available for us to analyze. And assuming that it's safe, and then assuming it's efficacious. It doesn't have to be perfect. Even if it reduces people sometimes, as the flu vaccine does, from having severe disease to only mild or moderate disease, that would be a huge victory, because the more symptomatic people are, chances are the more likely they are to spread disease. Asymptomatic people are probably less likely, but still quite capable of spreading. But certainly, if somebody is having a significant amount of coughing, a significant higher load of virus, and has more severe disease, those patients clearly are more infectious, more contagious. And if a vaccine not only can prevent some illness, but also can make the illness on a lower level, so then that may be a wonderful thing as well. So optimism still is, I think, the word with the vaccine. I think the synthetic antibody cocktails have 3 published studies this week that all showed some value. There was one published study showing no value when it was started much later. And again, I think it's beginning, hopefully, to see the light at the end of the tunnel. I'm sure I'll take some questions at this point in time.
Okay, thank you very much, Rabbi Glatt. First question, is the increase in cases leading to a proportional increase in hospitalizations, ICU admissions, and deaths when compared to March and April?
So it's very hard to say that for certain. The one thing that we clearly do know is that the mortality in almost every center that's looked at this, including our own, where we've looked at our own data, as well as what's been published in the literature, shows that the mortality rates have definitely gone down. And that obviously will translate to lower patients using the ICU, patients needing intubation, and patients unfortunately dying. So in that sense, we do manage these patients much better. So the answer to that is clearly yes. However, it doesn't mean the virus is weaker. And people shouldn't mistakenly think that now is the time. I've heard some people say an amazing thing, get the virus now because it's a weaker virus and it's a good opportunity to get it. And that's just crazy, obviously. You shouldn't actively go out and get the virus. I mean, that's just beyond belief that anybody would think that. And again, the antibody question still remains unknown. Sinai just published a major paper in Science that actually contradicts some of the previous papers. And the Sinai paper showed that antibody does not wane as much as we had seen in some of the other papers. So the question still of what does antibody mean? People that got infected around Purim and Pesach time, and they have no antibody, or they do have antibody. So unfortunately, we still don't know fully what that means. My personal thought is that it's definitely protective. And the question is, how much so? It's not known at this point, and therefore we still have to be extremely cautious. And I tell people, don't assume because you once had antibody that A, you still do, and that secondly, it's even effective in preventing a second infection. So those are things that we still need to learn more about. But the Sinai paper in Science was actually a very good paper in that it showed that 90% of the people did not lose their antibody at 3 months period of time.
Are there any cases of those with antibodies passing on the virus to others?
So there are people that have gotten second COVID. So in those cases, clearly, yes. There's also a lot of information coming out about second COVID, and I'm aware of some preliminary information. I had a discussion with a major investigator in the Midwest, and they have some interesting data, and there are other places that have similar data that you may be able to detect the virus in the NP swabs, the nasopharyngeal swabs that are taken, those deep nasopharyngeal swabs that are taken for much longer than the 6 to 8 week maximum that we had thought. And that's really, again, throwing into question a lot of our thoughts about, can you potentially transmit virus? Could it come back and re-exert itself? So again, we're learning more about this virus every day, and it's an extremely cunning virus, and it's an extremely deadly virus. And we have to be very careful when people make statements about this virus, and certainly if they're not knowledgeable, and they say that mask wearing is no good and that lab testing is no good. These are all government plots. So those people are ignorant. Those people are making a terrible mistake. They're going to cause people to die. We've opened up testing, free testing in the 5 towns through Nassau County and through the state to try to identify people, not to close yeshivas. The purpose of this is so that we can stop spread, so we can stop people in our community from dying. I mean, it's nonsense that people are advocating and recommending don't get tested. Testing should be done appropriately. It should be done under a doctor's guidance. It should be done when you have symptoms, because if you have symptoms and you have COVID, you must isolate. You're going to hurt other people. And I don't understand how anybody could possibly say anything else. They're just ignorant.
If somebody tests positive, at what point in time, based on the symptoms, should they go to a hospital and perhaps get the cocktail that you mentioned?
So the cocktails are not available yet. None of those medications are available outside of a study setting. So you have to go to an institution that is doing that particular study. I know we will be starting. I'm hopeful. Sometimes these paperworks take a very long time, and government regulations still take a very long time, but we hope to be starting at Mount Sinai South Nassau a similar type of a study. In the city, there are a couple of institutions, including Mount Sinai Hospital, that are involved already in those studies. And again, at this point, we can only get it through what we call emergency compassionate release, and it's not easily obtainable in that fashion. There's at least a 5-day waiting period, which may unfortunately make the drug not as effective as it should be. The trick is not to get infected if at all possible, and not to need these drugs, although we're very hopeful that as data like the 3 studies that I mentioned are published, is being looked at by the FDA right now to give it emergency use authorization. If it gets emergency use authorization, then it will be available, just like remdesivir became available at a regular routine usage. And that's the hope, that once these studies are analyzed by the FDA, that we can get usage much more easily than through compassionate release usage, which is a difficult type of release. But if we get emergency use authorization, so then it should be available. And I do think it will be very effective based upon these 3 published studies.
So at what point should someone seek hospitalization? What symptoms should they be experiencing?
So I think anybody who's diagnosed with COVID should be followed by a physician. Absolutely. The idea that people are taking care of themselves, people with any other disease don't take care of themselves. If you have mild COVID, you need to have a call to the physician and even a telehealth visit to ascertain what type of follow-up you need, whether it's routine monitoring of your oxygen saturation with a simple thing you put on your finger that you can purchase in a local pharmacy or drugstore. So those are essentials to follow somebody with COVID, assuming that the doctor thinks that that's an appropriate management. If somebody's absolutely asymptomatic and they got tested and they're positive because of they were exposed to somebody, so they may not need any follow-up, although I think an initial assessment is certainly reasonable, and that should be done through a physician. People shouldn't be practicing medicine without a license. Not everybody needs to go to the doctor. Not everybody needs to go to the doctor every day, by all means. But certainly, I can't stress enough, anybody with shortness of breath needs to either go to the emergency room, call out solo right away, or depending on the severity of their shortness of breath, they need to see a physician. There's no substitution for this. And when in doubt, call Hatzolah. That's the clear-cut rule. If you're not that sick, call your physician. You should establish a relationship with a physician. That's critical. I get a lot of emails and calls. What do you think I should do? And then they tell me they're COVID positive. And I say, aren't you being seen by a physician? And they say, no. And I don't understand that. A telehealth visit, you don't have to even leave your house. If you're feeling fine, call them up and make an appointment via telehealth and make sure you're getting appropriate follow-up.
We hear this plenty of times, so I'd like you to comment. Could the increase in positive numbers just be due to better testing?
So a component of it is due that we're testing more people. We're testing many, many more people than we did previously. But how do you account for increased deaths in the United States, which is increasing? How do you account for us having more patients in the hospital now than we did 2 months ago? How do you account for the increasing number of hospitalized patients in New York and New Jersey over what it's been in the previous weeks? So if you're just looking at tests, yes, if we're doing more testing, we're going to have more positives. But if you're looking at illness, we're seeing more ill patients. That's not a function of increased testing. Those patients are sick. They need to be in the hospital. They need to be seen and followed by physicians. That's not a question of increased testing. These people would have probably come to our attention with or without increased testing. It's crazy to blame testing on the reasons why we're seeing more numbers. That's a small component of it. Yes, we're seeing more asymptomatic people. That's not what's spurring the concern. The concern is the increased hospitalizations across the country, 41 states. In Europe, they're seeing lockdowns right now because of the massive increases that they're seeing. They've gone way over the United States. These are real problems. This is not increased testing.
Should people be routinely tested, or what should trigger a test?
So currently, I do not recommend people get routinely tested by any means. Outside of a study setting, or outside of an exposure setting, or outside of a symptom setting, or if there's a reason to, for example, you're screening students in a school. None of the testing should be punitive. We shouldn't be closing down places because there's a certain percentage of tests that are positive. We should be trying to quarantine and appropriately isolate people while we keep everything else open. Because if we can minimize serious spread, super spreader events, then we'll prevent these problems from occurring. And appropriate testing, an appropriate isolation, appropriate quarantine, that will be how we keep everything open. If we don't do this and we hide our heads in the ground and just let things be whatever they are, then we will end up closing things down again. I have absolutely no doubt about that.
There's a lot of questions relating to travel. Apparently, Governor Cuomo came out with some new guidelines today. Somebody wants to know if they're coming back from Florida and they took a COVID test on day 5 here in New York and it was negative. Do they still have to quarantine for the 2 weeks?
I heard about the new announcement from the governor. I haven't seen the actual document itself, so I don't want to make any comment on it. I need to review the document.
Okay. That means you kept Shabbos. Thank you. For how long are people contagious before symptoms appear?
So we don't know that answer for sure. We estimate at least in the preceding 48 hours, we consider somebody potentially highly contagious. The pre-symptomatic state is different than the asymptomatic state. Asymptomatic means somebody who has COVID and never develops symptoms. And that's pretty common, especially in younger people. Maybe 30, 40, 50% in some populations never develop symptoms. That's great news for those people, but they're contagious. But in a pre-symptomatic person, that means they're going to develop symptoms. They're much higher contagious level. And therefore, in the preceding 48 hours, we recommend that anybody exposed to them be considered a full-fledged exposure. It may actually be more than 48 hours before then, but we use 48 hours as a cutoff. But I tell people, even if you were exposed 72 hours, maybe you don't need to go into quarantine, but you should be especially careful and you should be especially cognizant that if you develop even the slightest symptoms, you must immediately isolate yourself and get yourself tested right away. We'll take one more question. I want to give people a chance to, get something before the next program starts.
Last question. We're familiar now with the infrared temperature thermometers that are being used at a lot of stores. Any data that it's dangerous in any way? Any negative effects?
So the infrared thermometers are not dangerous. I just don't think they're very effective. So I personally would say, maybe from a bracha point of view, it's a good idea. Put a besomim by each store and have the person smell the besomim, make a bracha if he smells them, and run if he doesn't smell them. I think that's actually probably much more accurate than the temperature taking. Very, very few people will have absolutely no symptoms and have a fever that they don't realize that they have a fever that we're going to pick up on an infrared camera. It's much more likely to be a false positive. And I'm not a big fan. Anthony Fauci said he's not a big fan of this. Most infectious disease people don't believe it's a very effective way to really prevent spread of contagious people. But any symptom, stay at home. I hope nobody has symptoms. Nothing would please me more than I don't need to give another Motzei Shabbos update next week. We'll see if there's enough information for me to do it. So please listen to the COVID announcements from the shul if there will be a program next week. Again, I remind everybody, please vote. Very, very, very important. The Jewish community numbers need to be high. And again, we have another program tonight sponsored by my good friend Charlie Mitgang, Lila Nishmas, his wife, Linda Mitgang, Alea Shalom, also sponsored by her children. And that will be Rabbi Yehuda Sarna and Dr. Michelle Waldman Sarna, who are now the Rabbi and Rebbitzin of the United Arab Emirates. That program will start at 8:45. I wish everybody a wonderful Vach.
Thank you again, Rabbi. Good Vach, everybody.
Good Vach.